We got the COVID vaccine.
We got the COVID vaccine.
So have I.
We have too.
Now that I'm vaccinated, I feel relieved, hopeful.
It's changed my life.
It feels like we've got our freedom back.
We can get out and go around and visit people.
I'm out of the cage now.
My dad is 94 years old, and I am just looking forward to spending a bit more time with him.
We can't wait to hug our grandkids.
I'm looking forward to going swimming.
We're looking forward to traveling.
And seeing my good friends.
To know that we're going to be able to meet our grandson, who we haven't gotten to meet yet.
It doesn't hurt, it doesn't cost you anything, but it does protect you and it protects lives of others.
I think getting the vaccine is the only way to get Ohio back to normal.
Please get the COVID vaccine.
Protect yourself,
your family, and your friends.
It's a game changer.
Don't hesitate.
Don't hesitate.
Vaccinate.
Welcome to today's webinar, The Road Back, Ohio's Adult Day Services Centers and Senior Centers. Hello, my name is Ursel McElroy, and I am the Director of the Ohio Department of Aging. It is my pleasure to join you today. It has now been a year since the beginning of what is arguably the largest public health emergency most of us will experience in a lifetime. COVID-19 took aim at older adults, threatening their health, their needed services, their interactions with loved ones, and their lives. Throughout, you have been called upon to be brave, flexible, and resilient, among other things, and I thank you. While we are still in the midst of the pandemic, I am encouraged that we have opportunities like today to begin restoring the critical connections we all very much need. During this hour, lines will be muted, but feel free to use the question function. We will make every effort to post helpful information, tools, and resources to address any questions you might have today. We do have a packed agenda. We will discuss the current Health Director order and what you can expect as we evolve the order, followed by a panel discussion featuring some of Ohio's well-respected physicians specializing in post-acute and long-term care. Finally, we are joined today by our colleagues from the Ohio Office of Budget and Management to review a second funding opportunity for Adult Day Service Centers and Senior Center providers. Our panelists will include Dr. Marla Haller, Dr. Stuart Cantor, Dr. Paul Muma, Dr. Laura Sorg, and Dr. John Wagon. Since the release of the amended director's order on the opening of adult daycare services and senior centers, vaccinations have been administered to thousands of Ohioans, and these vaccines have been shown to help prevent COVID-19 infection. The order supports our state's continued commitment to provide vaccination to all older adults. It also recognizes the importance of combating isolation caused by the COVID-19 pandemic and helps to provide opportunities for social interaction to improve the overall health and well-being of our residents. We will evolve the amended director's order on the opening of adult daycare services and senior centers. Once published, it will be incumbent upon you to implement in a manner that is compliant, yet exercises good clinical and safety practices. As Adult Day Services Center and Senior Center administrators, you can help protect your staff and program participants from COVID-19 by promoting and engaging in preventive behaviors that reduce spread and maintain healthy operations and environments at your facilities. It is still expected that each facility will evaluate all of the following as a part of developing a comprehensive plan to facilitate, implement, and oversee safe operations. These things include the case status in the surrounding community, understanding the case status within your facility, having adequate staffing levels, access to testing for participants and staff, personal protective equipment supplies, and understanding your local hospital capacity. The order contemplates that operations can be conducted through different means based on a facility structure and participants' needs. Yet in each circumstance, it is expected that best practices of infection prevention and control be adhered to. These include, but are not limited to, screening all who enter a facility for COVID-19 symptoms, logging contact information, wearing a mask, practicing good hand hygiene, social distancing, cleaning and disinfecting high-touch surfaces. It will also be important to revise your written policies in a manner consistent with the order and to educate participants and staff about the risks of the spread of COVID-19 and the appropriate safety measures to take to protect themselves. Adult day service centers and senior centers often provide a safe community-based group setting, which deliver a range of health and social services. This is often done through frequent social activities, group dining, communal spaces, and shared transportation, all things that can increase the risk of COVID-19 spread. So we encourage you to prioritize outdoor activities over indoor activities when possible. Utilize virtual activities where practical to do so. For example, you can conduct group activities for music, games, and social groups using FaceTime, Skype, Teams, or Zoom. Staggering appointments and signing up participants are also good strategies where feasible. And then a bit about testing, as vaccination coverage continues to pick up throughout Ohio's communities. While there is excitement about the progress made, we must be vigilant about using the tools we have appropriately. COVID-19 testing has been and remains important in our efforts to swiftly detect cases and take action. Persons with signs or symptoms of COVID-19 should have diagnostic testing. Rapid point-of-care serial screening can identify asymptomatic cases and help interrupt transmission. This is especially important when community risk or transmission levels are substantial or high. Next, our panel of medical experts will spend several minutes addressing the value of testing and its relevance as we evolve our state order. Dr. Wigan?
Thank you, Director. So much has happened over the past 12 months. If you think back to where we were in March of 2020, first of all, testing was not available a year ago. We had a lack of swabs and reagent, and now we have the ability to do testing when necessary. And we also better understand the behavior of COVID-19. The fact that there are individuals who may be totally asymptomatic who have COVID-19 and can spread it to colleagues and other individuals. And certainly the pandemic has taken a significant toll on employees of congregate care settings, and in adult daycare and senior centers, they've had to close, and that closure has been difficult because that's a vital resource for communities. And certainly we've seen the effect of COVID on individuals, not only staff, but also the clients that we serve. And so COVID has been one of the conditions that over the course of the last year, we've gotten a better understanding about it, and we feel like we're now better able to address these issues moving forward. A friend of mine compared this to, over the past 11 months, being like a turtle pulled into our shell. And I like this quote that like a turtle, every man and woman must stick his neck out if he or she wants to go forward. And I think that's where we are now in Ohio. We're able to move forward cautiously, but courageously. So we're going to go through a couple testing cases, case studies that can help highlight how Ohio is going to move forward in adult daycare and also in senior centers. So this first example is an adult daycare center that specializes in Alzheimer's and dementia care, which reopened its doors back in early March. There were 20 clients served, and they chose to receive the COVID-19 vaccine through local health department. and all were at least 2 weeks out from their second vaccination. At the recommendation of a physician advising the adult daycare center, all the clients and staff received a baseline PCR test before opening. Surprisingly, one of the clients and one staff member were positive for COVID-19, despite not having symptoms and having been vaccinated. The staff member had rheumatoid arthritis, which is considered and was considered immunocompromised due to her medical condition and the medications that she takes to manage it. So I'd like to ask Dr. Sorg these questions. So did these two individuals get COVID-19 from the vaccine, Dr. Sorg?
That's a great question. And the answer is no, it's just not possible. With the type of vaccine that the COVID-19 vaccines that are out there commercially available at this time, none of them are live vaccines. And so it would just absolutely be impossible for someone to contract the virus from the vaccine.
And so wouldn't these tests be considered false positives?
That's a great question too, because I think we see a lot of things going out there on social media like, oh gosh, it's been 4 weeks out from my vaccine series. I must have had a false positive. How could this be? And the answer is no, they're not false positives. We have such a fortunate capability to vaccinate right now, and the vaccines available are so effective, especially it sounds like, these folks probably got like Pfizer or Moderna, which again, gosh, when you think about 94, 95, 96% rate of, again, efficacy against severe COVID, that's huge. Unfortunately, there's going to be a few percent, maybe 4 to 5% of people that just will not create antibodies. And especially people that might be more immunocompromised, or they might be on specific medications without knowing this person's history with the RA. Maybe that person is on some certain medications that makes it a little tougher for them to create antibodies to something. There's going to be a few people that unfortunately will just not develop antibodies. That's why it's so important for us to develop this herd immunity. And the more people that are out there getting vaccinated, the better. And also for us to continue to do the things that we're doing, such as masking, until we can get that herd immunity up.
Thank you. And actually, it's also good that even though they were positive, they didn't have to go to the hospital. They stayed asymptomatic.
Absolutely, because that's the other part of things is, again, we do know that with the vaccine, there are other benefits, right? Oftentimes people might not get severe COVID, right? They're not going to end up in the hospital on a ventilator. They might not be shedding the virus as much. Those are huge things and really benefits. And that person who is immunocompromised, I'm thankful they were able to receive the vaccine as an employee, because that might have protected them from having severe COVID and winding up in the hospital in the ICU on a ventilator.
Thank you. So, so there's a little bit of confusion, I think, about the different tests, what their abilities and limitations are. And so I use this graph frequently to help people understand the benefits and limitations of PCR tests and rapid antigen tests. So if you look at this graph on the horizontal axis, it's really the time in weeks from the onset of symptoms. Now, as we just talked about, sometimes people don't develop symptoms, so it makes it especially tricky when you're dealing with COVID-19. But if you consider that a person was exposed to the virus at -1 week, you can see they'll start developing the ability to be detected by both the PCR and the rapid antigen testing, such that about the peak of that is about 1 week after that exposure. The PCR test will remain positive for sometimes up to a month or even longer than that, whereas the rapid antigen test will peak at about 7 days, but then drop off relatively quickly within another additional week. And so there's a narrow window for rapid antigen tests to be able to detect if somebody is asymptomatic or even symptomatic and positive. The PCR test, the first time you check a PCR test, we're not sure if that was due to something that might have happened a week ago, and so they're positive and perhaps shedding virus at that time. We also found out last spring when we were trying to use the PCR test to clear people as being not infectious, and we wanted to try to get 2 negative PCR tests in a row. We found out, a month and sometimes 2 months later that we weren't able to get 2 consecutive PCR tests to be negative, and that's because the person was shedding viral particles. They weren't infectious. They were just shedding the breakdown products of the virus, which the PCR test is extremely sensitive for. So really the benefit of either PCR or rapid antigen is if you check it on a regular basis every week or so. If somebody changes from negative to positive, it helps us understand that indeed they were exposed to COVID and therefore are actively potentially infectious. So let's go on to our next case, and this is a make-believe adult daycare called Lending Hands Adult Day, which decided to take advantage of state-supported testing using PCR tests. And Nurse Nelson did not elect to be vaccinated when it was provided by his employer. So he was tested on Monday, April 5th, and incidentally, 2 days later, when they got the results of that test, it was negative. But that night, on Monday, April 5th, Nelson decided to go over to a friend of his house and watch the NCAA basketball championship game. And Nelson was unfortunately exposed to somebody who was asymptomatic but had COVID. And he actually caught COVID that evening, but he remained asymptomatic. He did not have any typical symptoms of COVID-19. So he went to work over the course of the next week, but on Monday, April 12th, he was tested again, and this time he was found to be positive when the results returned 2 days later. So I'd like to ask Dr. Cantor, is it really necessary for adult day staff to be tested on a weekly basis at this point in the pandemic?
Thanks, Dr. Wigan. Testing has been something that has been highly utilized, and I can certainly relate to the fact that there's a lot of testing fatigue going on out there. As an individual that's tested twice weekly, I know this has become a cumbersome issue, but definitely people need to be continued to be tested. The reason is for all the things that Dr. Sorg and you talked about. The fact that people may be without symptoms. So they may have the COVID-19 virus and they may display no signs or symptoms. They may also have been vaccinated and be that small percentage of people that Dr. Sorg discussed that may not form antibodies. And then the third issue is you may have been vaccinated, but it is too quick for you to have developed antibodies, and you may have been exposed to the COVID-19 virus right before vaccination, which is why 2 of the commercially available viruses require 2 doses. So in no uncertain terms, we need to continue to be we need to be continued to be tested on regular cadence, and just ask everyone to hang in there. We're going in the right direction, and I don't think that testing is going to be with us for the future long haul, but certainly for now.
Thank you, Dr. Cantor. And Dr. Muma, why do vaccinated employees need to continue to be tested?
Well, primarily, the virus shed by a vaccinated employee who has been infected is just as infectious as the virus that's being shed from an unvaccinated employee. And like Dr. Stork pointed out, it's necessary to be very vigilant because we still have a small amount of penetrance into the vaccinated population. Even if it's only 3 or 4 people out of 100, if you have 100 vaccinated staff, you have 3 or 4 people who will be contracting the virus statistically.
I'd like to call on Dr. Haller to talk about the R3AP program, which is an innovative program that is being launched by the Ohio Department of Aging, and of which a number of the physicians on this call, are participating. So, Dr. Haller, can you explain this new program?
Thanks, Dr. Wigan, and thank you to the Ohio Department of Aging and Director McElroy for recruiting me actually to be a part of this team. And this Rapid Response Assistant Program was created with the mission to provide support to COVID-19 prevention, to congregate care settings, and to assist during and after the COVID outbreaks. So we know that ODA, serves and advocates for the needs of the Ohioans aged 60 years and older. And we know that this aging population in the congregate care facilities experienced major disruption in service and function during the COVID-19. So, it is a clinically based program and regionally organized. It aligns to complement the regional assets and the organizational solutions that are already serving all Ohioans. So it is a program that we hope can be replicated in the future and activated in the event that we have other healthcare emergencies like COVID-19. Although we are aligned to be very integrative. And so this integral team is comprised of a regional operational coordinator, a medical director, an infection preventionist, a PPE coordinator, an outreach support team for vaccination and testing, a social worker, and a chaplain and hospice specialist. And so, as you can see, it's all clinically based and regionally organized. And next slide, please. It correlates with the emergency preparedness regions. So we have 8 regions, as you can see from the slide, and each region has its own team, and that team members are in the previous slide with all of the different disciplines that are collaborated together. But the regional teams are headed up by the medical directors, which they're listed on this particular slide with Dr. Lehner, Dr. Coleman, Dr. Sobel, Dr. Cantor, Dr. McLean, Dr. Schonk, myself, and Dr. Muma. And then we also have a clinical advisory group. And, I have to really also note them for their valuable wealth of knowledge in helping to guide this approach with regards to COVID and the R3AP. So we really envision that with the development of this program, that we will be able to serve all Ohioans and be a great resource.
And I know Dr. Muma and Dr. Cantor, you're both regional medical directors, and you've worked closely with the Ohio National Guard and how they've supported the program up to this point. Do you have anything that you'd like to add about the R3AP program?
Yes. As you said, I've been involved from the inception, and I think it is an outstanding resource for people in congregate settings. It's been a nice, cohesive group of people designed to try to have information and resources available to those who are in need. There's been a strong correlation between the National Guard and the public sector. So far, I think it's been an outstanding venture, and I think only more good things are to come.
Yes, I have to second that. The involvement I've had so far has been inspiring. The more effort we direct toward vaccination, resources, and testing, the better we will do at combating this pandemic.
Thank you. So on the next slide, we do want to provide a little bit of guidance for our senior centers who may have called in. The senior centers also are slightly different than some of the other congregate settings in regard to the adult day and nursing homes and assisted livings really provide a steady support for a group of individuals that depend on them. Senior centers also provide an important role that is a little less centralized. In other words, people can choose to come or go or not participate. And so, the Department of Aging has chosen at this point in the pandemic to be a little less prescriptive and not require testing of senior centers at this point, but yet spend our efforts through the Department of Aging and through, if necessary, the R3AP program to really focus on the importance of education, talk about infection prevention, to also provide some education about COVID-19 and how it might affect individuals in senior centers outside of in their regular lives. And so there's going to be a concerted effort moving forward on providing education for individuals who decide to utilize senior centers. And this is a great model that I think we have used to help understand the strategy for addressing COVID-19. We know that there are no single strategy that will 100% prevent the spread of COVID-19. So we've tried to implement a number of different strategies. We've recommended people do screening surveys and checking, temperatures, forehead temperatures, for example. We know that that isn't going to identify 100%, but yet it does something. It is beneficial in hopefully preventing people who are infected from coming in. You combine that with wearing of a face mask, and that's probably one of the single best ways on a day in and day out basis, short of a vaccination, that you can do to prevent the spread or even catching COVID from another individual. You combine that with hand hygiene and sanitizer. It may not completely prevent it, but when you combine it with the other pieces of Swiss cheese, will limit the actual spread using those. And then social distancing and vaccination really kind of complete the strategy in adult daycare and even senior centers from the standpoint of preventing COVID. Now, we could add another piece of cheese in there from the standpoint of doing testing. And I think in certain circumstances, we've decided to continue that. And in other circumstances, we feel like it's okay for us to drop that strategy. But what's important to remember is that there are no zero risk solutions. In other words, it's through a combination of a number of strategies that we can approach a decreased risk, but we never get to a zero risk. And so we're going to have a phased approach to participation in all these different activities. And as was mentioned before, it's our hope that over the course of the next month or two, as the vaccinations, the population continues to become vaccinated, that we will continue to move forward in decreasing the risk to everybody of of the spread of COVID-19, and we can get back closer to a way of normal life as we remember a little bit longer than a year ago. So thank you very much.
Thank you, Dr. Wygand, and hello, everybody. I'm Julie Trackler, Assistant Director for the Ohio Department of Aging. In this next and final segment, we'll be talking about a second funding opportunity to assist you by offsetting costs for reopening and losses that you have incurred due to the pandemic. We offered the same opportunity last fall, so this is an update with new extended dates for eligibility. I'll talk with you about the purpose of this opportunity and give you a recap of the first opportunity that went out and also the second opportunity and talk about eligibility. And then after that, Jessica Martin and Jason Bartholow of the Office of Budget and Management will provide some hands-on and actually eyes-on visuals to explain the process for applying for these funds. And then I will come back and talk to you about additional questions that are specific to this request, the timeline for this grant opportunity, and what support you can count on from us. So what is the purpose of this funding opportunity? This funding opportunity is to assist you in offsetting costs incurred for necessary expenditures that you've incurred in order to comply with health orders, safe reopenings, and related response activities due to the COVID-19 public health emergency, and also to compensate for losses due to your business interruptions. We'd also like to point out that if you are assisting with vaccines in your communities, this would also be counted as expenses that you can turn in. So who's eligible? Adult day and senior centers. So coronavirus relief funds. Let's talk quickly about these funds. These are coronavirus relief funds, and on October 16th, 2020, we announced that we had a $15.2 million allotment available to support your reopening efforts. At that time, this time period for these funds ended at the end of December. The time period was expanded into 2021, so we're pleased that we're able to announce and launch the second funding opportunity today. For the first opportunity, we awarded $4.8 million to those entities that applied. So based on applications at that time, that was the total of the payments made. Thus, for the second opportunity, we have about $10.4 million available for award. So eligibility, who's eligible? Again, Ohio's adult day service providers and senior center providers. You can be private, nonprofit, or government funded. And for those of you who receive funding through the first opportunity, you're probably wondering if you're eligible for this second opportunity. The second opportunity expands the time period from March 1st, 2020 to June 30, 2021. So if you have incurred additional expenses and losses, yes, you are eligible to apply. For those who did not apply for the first opportunity, you are also eligible to apply for the time period, again, back to March 1st, 2020 through June 30 of 2021. So with that, we'll now move on into the grant application process. First up, Jason Bartholow will talk about the state's requirements to sign up in our supplier system in order for you to receive your payment electronically through your bank. There are a few steps, and Jason has some good visuals, so we encourage you to stay tuned in to this webinar, but immediately after it closes, we ask you to go to the supplier portal if you're not already a registered provider, and get yourself registered to receive your supplier ID. After Jason, Jessica Martin, also of the Office of Budget Management, will walk through the foundational information of these grant funds, and we'll walk you through the first half of the application. And then I'll join back in and walk you through the second half, and we'll finish up after that. So with this intro, I will turn it over to Jason to explain how to receive your supplier ID. Jason?
Thanks, Julie. And again, my name is Jason Bartholow from the Office of Budget Management. And I want to talk to you about an important first step in the grant application process, and that is registering as a State of Ohio supplier. This is a two-step process. Very important to note that there are two steps First, you'll register for your OHID, and that is the login credential system that the state has adopted for access to many state applications, including the supplier portal. So if you don't already have an OHID, when you go to the supplier portal at supplier.ohio.gov, you'll see a link, a button to create a new OHID account. So you'll click on that button. Next slide, please. And from there, you'll enter your information for an OHID. It's a pretty straightforward process, but you're going to enter your name information and a date of birth. And then you can also add a phone number and the last four of your social security number should you choose to. Those are optional at this stage. And if you have any concerns about, entering this personal information, just note that we're collecting this information so that we can ensure that you actually are the person who's registering and limit fraud opportunities. So we collect this information to make sure, that we've got the right person registering for an account in your name. You'll enter your email address information, and it's important that you click that verify your email address checkbox, and that's going to send an email to your email address with a PIN number, and you'll enter that PIN here. Once you've done that, then you'll set up your user ID and password. The guidelines for both the user ID and password are provided, so it's important that you note those and create a user ID and password that meet the requirements. And then you'll agree to some terms and conditions and answer the verification question. Just make sure that you're not a robot trying to create an ID, and then click Create Account. Once you've done that, you'll see that you've successfully created your OHID account. And with that, you've completed step one of this two-step process. So once you have your OHID set up, you'll go back to the supplier portal at supplier.ohio.gov and enter the username and password that you created in step one. Once you've done that, click Login. Next slide, please. And then you'll see this page with three panels. And if we can scroll down just a little bit, in that middle panel, you'll see New Supplier, and you'll click Start Registration. Once you click that, you'll see this Begin Registration page, and it gives you some information about things that you need to have available as you begin the registration process. It's important to note that you will need a hand-signed copy of your W-9 form. And when you fill out that W-9, it's important that you record the correct legal business name. This is the name that you use when you file your taxes with the IRS annually. And then the associated TIN number, and also the correct tax classification for your business or situation. You also want to have your banking information. The state of Ohio wants to pay you electronically, and so we'll require banking information in one of the later steps of the registration process, and then also the address to which you want payment sent. With that information, you'll click Start Registration and work through each of the train stops indicated on the line with the circle icons at the top of the page. Through the process, you're able to save if you need to and come back to the registration later. If you choose to do that, you'll log in again, and then when you get to this page, you'll see Continue Registration. You can click that, and it'll take you back into the registration, and you can complete the process. Do want to note again that you'll be required to enter banking information, and then also that last step in the process for commodity codes. You'll be able to select the type of business that you have, and that'll allow the state to send you information about future contract opportunities. Once you've fully completed the registration and clicked to agree to terms and conditions and submitted the application, you'll get this registration ID. It's important to note that this ID is not your supplier ID, but it is an ID that you can use should you need to contact OBM about your registration. That'll help our shared services associates to find your application. Once you've submitted, about 2 or 3 days later, you should receive a response from OBM Shared Services, either with your supplier ID or with instructions for correcting some information. Once you have the supplier ID, the process is complete and you can use that in your grant application process. So just a quick overview, you're going to create your OHID for login, and then you will register as a supplier of services. You'll receive a registration ID, and then a couple of days later, you'll receive either your supplier ID or further instructions. And then you can begin the grant application process. With that, I'll turn it over to my colleague, Jessica Martin.
Thanks, Jason. Yes, now I'm going to talk you guys through the overview of the coronavirus relief funding, a little bit about what are some eligible and ineligible costs, and then how to actually go about applying for the funding. So basically, the Coronavirus Relief Fund is federal financial assistance from the U.S. Department of Treasury. The performance period is from March 1st of 2020 through December 31st of 2021. But you remember, as Julie said, for this specific opportunity, the allowable project period is between March 1st, 2020 and June 30th, 2021. Next slide. There are a couple of different authoritative requirements. So the CARES Act, the U.S. Department of Treasury guidance, and they have frequently asked questions as well. There's a couple of uniform guidance sections, but the most pertinent thing for your population will be the additional guidance that's provided by Ohio Department of Aging, and that is an attachment in the portal that we'll show you a little bit later. Next slide. So just some overarching cost eligibility criteria. Basically, if the cost is a necessary expenditure due to COVID, so something you wouldn't have otherwise purchased or had to spend money on before the COVID-19 virus, that is one of the key criteria for it being eligible. Secondly, is if it's something that was not previously budgeted, so in prior years you wouldn't have spent money on it, and then if it was incurred during the appropriate period. So some specific examples and the things we're seeing most commonly, especially with different providers, are PPE equipment, disinfection of public areas, enhanced cleaning. If there's different touchless precautions that you're putting into place, like in bathrooms or in different public areas, any barriers or social distancing measures that you're installing, even communicating or complying with public health orders, expenses associated with COVID-19 testing, contact tracing, even for quarantining employees. These are all eligible costs as well. I know with your population, especially food delivery to vulnerable populations, that is an eligible cost as well. And then a couple other ones are business interruption costs. So costs that were caused by closures or reductions, if you had a loss of revenue for your business. And these could be different operating costs, that you would have to cover in order to make sure you don't go out of business completely. So it could be personnel, insurance, utilities, rent, groundskeeping, etc. Please do note, though, that governments are not allowed to use business interruption costs as revenue replacement. Can you go back one slide? Other types of entities are allowed to use this business interruption costs. And I did just want to point out too, 1099s will be sent for the amount of the funds. And like what Jason was saying, that's why it's very important that you use your tax name when you're submitting your supplier ID. Okay, next slide. Some different prohibited use of funds. I won't go through all of these, but workforce bonuses, anything that is already reimbursed. If you received other federal funding such as the PPP, severance pay, prepayments on contracts. So you can review these later. Next slide. Please do keep any support for how you use the funds for a period of 5 years to align with the Treasury requirements. And you can provide those in case of audit or monitoring visit. Next slide. And the financial status reporting, this will also take place through the grants portal. So if you receive the funding from the first opportunity, you are already familiar with this. And your reporting date will be July 7th, 2021. And so that'll be any, activities that took place or your expenditures that took place through June 30th. And you can go to our website and see more reporting resources, and you'll get reminder emails, once that reporting is available and due. So finally, how to apply for the opportunity. So you'll go to the grants website for Ohio, which is grants.ohio.gov to find it. And next slide. So at the top, you'll click on funding opportunity. And then that will bring you to this page, and then you'll have to click access to the active opportunities, that button. There is a little area, and you can see even on the side here, for archive funding opportunities. So after the application period closes and you want to go back and see the original information, you'll be able to find it under that section. So then you'll click on one of the funding opportunities, and then you can bring up specific details about that. So the time period, the project period, different financial details even. Here's an example of one that's currently open for veterans posts. Then at the bottom of that page, you'll click on the register button. And here is an example of what the application will look like. It is not, this is a previous example, but it'll look very similar to what you will see. And I know Julie will go over the exact questions that you'll see. So you'll just fill out some information about your organization, just basic demographic information. And then here's where you can associate your supplier ID with your application. So it is optional at this stage, but remember, like Julie and Jason were already explaining, that the supplier ID will be required for the actual payment. So if you already have it, then you can, go through this lookup process. And you just enter your supplier ID and/or your supplier name, and you can search for it, and it'll return a list. And then you just select the correct supplier record. Then there will be 20 additional questions. Again, these are just the sample questions that you'll have to answer. And as you can see, the fields are notated in red with an asterisk, so they will be required questions. But it's just going to help the Department of Aging vet the different applications and then know how to award the payment amounts. Then there's some information about the different compensated officials so that we can fulfill FAFATA requirements. So these may not apply to all organizations, and you will know if they apply by answering the different yes/no questions, and then it will pop up if it applies, and you'll just have to complete that. For the authorized representative and the grant contact, it's important to put the individual that you want to be completing the activity reporting as the grant contact. The authorized representative is just someone else in your organization that's able to speak to us on behalf of the organization. But yeah, the grant contact is the main one that will be getting notifications and reminder emails about financial reporting, and then also about approval or if there's more information needed. And then on this last page, so this is the certification page. So, just read through, and then you are certifying that you agree to, and this is example wording, you're agreeing to all this by applying, and then you will hit eventually where it says form and complete at the bottom, that will say submit. So you can go to the next slide. If there is something that's not completed on the application, so if you miss one of those fields, then the form incomplete button will say like that and it won't let you submit it. So, just make sure, double check that everything has been completed, and then that will change to a submit button. You'll be able to submit it. And then now I'll hand it over to Julie, who's going to go through the different additional questions that are specific for your funding opportunity.
Thanks, Jessica. This is Julie again. As Jessica mentioned a few slides ago, there are additional questions. So I will walk you through these required questions. These are specific to your business experience before and during the pandemic and is used for our analysis. So there's 20 questions in total. I'll quickly touch on all of them and we'll dive deeper into just a few where we think you may have questions. So question one, this question is making the point that you'll be asked for the name and contact of your authorized rep and your grant contact. And Jessica mentioned that just a minute ago. So this is important, and this is basically just a yes or no. We just want to make sure that you understand the distinction that we will be chasing the grant contact more so. Question two is just a reminder to register to be a supplier. So yes, no there. Question three asks if you applied for our first round of funding, and if you did, list that award amount. Question four, list an A or a B depending on your business structure, private, nonprofit, or government. As this comes up, it's one of the final questions in the application, so just be aware of that. But it's important that your grant contact be easily accessible. So question 5 and 6, they're asking about your staffing levels pre-pandemic and currently. Questions 7 and 8 are asking about the number of older adults that you're serving pre-pandemic and currently. And question 9 asks about the services that you provide. Question 10 lists your, asks about your funding sources. So if you just list those there. Questions 11, 12, and 13 pertain to your last audit and your fiscal year end date. 14 asks for the date that you reopened or the date that you plan to reopen. Question 15 asks the number of days that you operate, either that you will operate or currently operating. 16 asks about the services that you will or are currently providing. For 17, 18, and 19, I want to hone in on these just a bit more. 17 focuses on your actual expenditures and your actual business losses. 18 focuses on your estimated expenditures and estimated business losses. And 19, but we're going to stay on this slide for now, focuses on actual and estimated expenditures to reopen. So let's look at question 17 a little deeper here. It says provide separately the actual expenditures in dollars and business losses in dollars experienced as a result of the COVID-19 pandemic. And this is for the period of March 1st, 2020 through February 28th, 21. So these are actual expenditures. So that's what we're asking for here. And ultimately you can add like one number and then hit a return and enter that second number for the expenditures and losses. In question 18, this is the estimated expenditures. Again, expenditures estimated and business losses, again, estimated for the period of now, March 1st, 2021 through June 30th, 2021. So again, you can list those two amounts in that space. And 19, question 19, this asks for your actual and estimated expenses to safely reopen. So for this question, you will take the amount that you have from March 1st, 2020 to June 30th, 2021. And again, all of these questions ask, the statement is, do not include any expenses that you have already or are expected to be reimbursed by any federal or state relief dollars. So if you've already included these dollars once, you can't count them again. So just be sure that any expenses listed here are new expenses that you did not previously report. And then finally, question 20 asks about the funds that you received if you are a Medicaid provider, and we ask for your 7-digit Medicaid provider number. So again, for each of the two-part questions, you can hit the return key to go to a second line or just leave space in between each of the two questions that we ask right there. This grant opportunity will open today. It should be live following this webinar. And you can begin applying today, but remember to first go to the supplier.ohio.gov website to establish your supplier ID if you have not already done that. This application process and portal remains open through Friday, April 9th. And then following the closure of the portal and this application period, the Department of Aging will begin its analysis of your submitted applications. This duration of the review will depend on the number of applications that we receive, but you can trust that we will be moving as quickly but as accurately as possible. The analysis of the first award took about 6 weeks to get through all of the applications. After that, we will make the determinations and payments will be issued and you will be notified at that time. So from a support perspective, in the portal, you will find 3 job aids to assist you in this application process, in your grants reporting process, and there's also guidance and frequently asked questions that you can look at there. If you have questions though that aren't answered through those sources, you can certainly email us at grants@age.ohio.gov, as you'll see there, grants@age.ohio.gov. And this concludes this segment of the webinar, as well as the webinar itself. So we greatly appreciate you tuning in, and thank you so very much for your continued commitment during this pandemic and all that you have done and are doing for your clients. Many thanks, and take care.